Prime Minister Modi will chair an important meeting on the COVID situation in the country at 10:30 a.m. The crucial meeting comes after the World Health Organization declared the new coronavirus variant to be a variant of concern, calling it Omicron. The WHO has classified it as a highly transmissible virus of concern, the same category that includes the predominant Delta variant, which is still a scourge, driving higher cases of sickness and death in Europe and parts of the United States. Early evidence suggests it carries an increased risk of reinfection compared with other highly transmissible variants. The B.1.1.529 or Omicron is the latest in the family of variants, causing a spike in cases in South Africa. Concerns of the new variant has triggered widespread travel bans with the European Union, US, Canada, Saudi Arabia traveling banned from South Africa. Paulami Saha is getting us more details on that big story. Paulami, good morning. This comes at a time when not just the new variant, of course, there are going to be concerns in India, given that we also have travelers from Botswana, Hong Kong and South Africa in India, and India is in the process of tracking them down. Essentially, more so also because a vaccination drive needs to pick up pace. The Prime Minister is expected to discuss all of this with the health officials today, isn't it?
Right. In about half hour from now, Sneha, the meeting will in fact begin at the Prime Minister's residence. The Cabinet Secretary, the Health Secretary, Dr. V.K. Paul, who is Niti Aayog member, who is of course overseeing the vaccination program, will also be present in that meeting. They will be of course discussing the COVID-19 situation and of course the progress as far as the vaccination program is concerned at that meeting. Now, this meeting is extremely crucial, like you said, after of course the WHO has declared that the Omicron variant of the virus is a variant of concern. And hence, there's a lot of panic across the world. We know that certain nations have taken steps in terms of blocking travelers coming in from South Africa. We've done nothing as such at the moment, but we're taking into cognizance all of the details that are emerging, the information that's coming in from the WTO, I beg your pardon, the WHO at the moment as well. And we will be taking a calibrated decision on the basis of that. Remember that we have only yesterday declared that we will be resuming commercial international flights from the 15th of December. We do have categories of countries as to how much of that capacity will be opened up. South Africa is, of course, declared as a country at risk and a country we do not have an air bubble arrangement with. So as per the category South Africa falls in, it is a category where we will be opening up 50% of international commercial flights. But again, starts on the 15th of December. Things could change before that, given the information that comes in from the WHO. So all of that will be reviewed in this meeting, Sneha.
All right, Paulami, thanks for getting us up to speed with that, Paulami Saha, with that report tracking that important meeting for us today that begins in just about 25 odd minutes from now. The Prime Minister is going to be talking about the new variant of concern. So what is B.1.1.529, now known as Omicron? Remember, there are 32, not one, not two, not three, but 32 mutations detected in the new variant, and that is rather worrying. It's evolved, at least that's the belief, through chronic infection in an immunocompromised person. It can be detected with only one particular test. So the conventional RT-PCR test may or may not be completely effective in detecting this variant. So it might just escape detection in that sense and then continue to cause more and more infections. Now, all of these concerns have been underscored by the World Health Organization. The WHO is also talking about something else. The WHO is talking about the rise in cases in general in Europe, in the USA. Let's talk about Europe now, for example. Europe is in a grip of a fourth wave. It's evident. Infections are higher than ever. Several countries are imposing lockdowns here. Europe now accounts for 3 in every 5 cases across the world. The WHO has now said that there could be as many as 500,000 more deaths by February 2022. I filed this report earlier. The COVID pandemic is far from over. In fact, it's rising with vengeance across Europe.
Probably by the end of this winter, pretty much everyone in Germany, it has sometimes been said, somewhat cynically, will have been vaccinated, recovered or died. But it's true. With the highly contagious Delta variant, this is very, very likely.
COVID restrictions are returning. In Germany, it's nearly 9 million people who are not allowed to leave home except to go to work or shop for essentials. Austria has announced a complete lockdown from the 22nd of November. It is the first European country to declare compulsory vaccinations from February 2022. Hungary, Belgium and Netherlands are also mulling shutdowns as the virus rages. On the 8th of November last year, Europe reported the peak of the year with 2.87 lakh new cases, which went down to around 40,000 on June 19, 2021. On the 21st of November 2021, new cases jumped again to 3.3 lakh, almost 61% of the world's new cases. Germany surpassed the United Kingdom in terms of daily deaths, and the gap is only widening. Germany now reports over 200 daily deaths. The crisis in Russia is deadlier, with the country reporting more than 1,200 deaths every single day, in spite of a decline in new cases. Germany had only 8,000 new cases on the 1st of October, but on the 21st of November, the number jumped 6 times to 49,206. It was almost the same story in the UK, in Russia, Netherlands, Australia and Italy. So what's really causing the surge? Is it waning immunity or vaccine resistance?
It is winter time when people gather indoors for festivities. The surge is expected to get worse. When a large number of individuals have infection in the community, there will be a proportional rise in the number of hospital admissions. Therefore, the hospital systems are being strained and lockdown has already been instituted in certain regions.
The World Health Organization is worried. It fears there could be as many as 500,000 more deaths by February. Deaths are being seen even in highly vaccinated countries.
COVID-19 is surging in countries with lower vaccination rates in Eastern Europe, but also in countries with some of the world's highest vaccination rates in Western Europe. It's another reminder, as we have said again and again, that vaccines do not replace the need for other precautions. Vaccines reduce the risk of hospitalization, severe disease and death, but they do not fully prevent transmission.
India too is concerned, given the opening up of international travel and a sudden rush to make full use of it.
This is definitely a time where the guard cannot be lowered. This is definitely also the time when the panic should not set in, the fear should not be set in. We should move in this phase with responsibility. Responsibility in terms of the COVID-appropriate behavior, which is still relevant. Responsibility to ensure that the adults are vaccinated. And responsibility on the part of the government to ensure that the surveillance, genomic surveillance and the preparedness is not diluted at all.
India is taking solace from the fact that 99% of COVID cases are courtesy the Delta variant that ravaged India in the summer of 2021. The same variant was first detected in India. That there is immunity to this variant, given the widespread exposure, and no other variant or lineage has so far been more dominant, is what is making India more hopeful. In New Delhi with Milan Sharma, Sneha Mordani for India Today. Well, after the new COVID-19 variant created scare across the world, global stocks, oil, Bitcoin took a beating. US stock markets fell sharply. Take a look.
Global stocks, oil, Bitcoin, everything took a beating Friday in a holiday-shortened session after a new COVID-19 variant was discovered. The Dow plunged 905 points, its worst day in more than a year. The S&P 500 tumbled 106. The Nasdaq nosedived 305. The new variant, which the World Health Organization designated the Greek letter Omicron, was discovered in South Africa. Little else is known, but scientists say this variant may be able to evade immune responses and could be more transmissible. Some countries are already tightening travel restrictions, sparking widespread fear the global economy is headed for a detour. And as Peter Cardillo, chief market economist at Spartan Securities, puts it, fear is the market's worst enemy.
Look at what's happening in the stock market today. If you look at the transportation averages, it's down almost 4%. That's a huge decline. And that, certainly indicates that the fear out there is that we might have lower economic activity going forward. And if that happens, that means lower earnings.
U.S. air carriers, which just saw international travel restrictions lifted, were hit over concerns people will be scared to travel again, just as the busy holiday season ramps up. United Airlines shed 9.5%. Friday, also known as Black Friday, was supposed to be retail's big kickoff to the holiday shopping season, but the variant reignited fear of a retail slowdown as well. Department store chain Macy's slumped more than 5%. The chill went beyond stocks. Oil prices plunged 13% on Friday in the largest one-day drop since April 2020 on fear of slower demand. U.S. crude fell below $70 a barrel for the first time since September. And Bitcoin proved to be no safe haven. A slide in the world's largest cryptocurrency left Bitcoin 20% below its record high hit earlier this month.